the members, the Speaker.
Honorable members, I declare the 17th sitting of the National Assembly of the Parliament of the Cooperative Republic of Guyana to be duly constituted and in session. The clerk will now lead us in prayers.
Almighty God, we are gathered together to most humbly beseech Thee to guide us in all our consultations, so that we may together build a land where knowledge is free, where the mind is without fear, the head is held high, and where words come from the depth of truth. Grant us, O God, thy need and guidance, so that we may deal justly with the several causes that come before us, laying aside all private interests, prejudices, and personal preferences, so that the result of our counsels may be to the glory of thy blessed name, the maintenance of true religion, the preservation of justice, the safety, honor, and happiness of the President, the peace and prosperity of Guyana. Grant us, O God, the vision so to lead, that all the people of this fair land may enter into that state of brotherhood and unity, where the mind is empowered by Thee, with ever-widening thought and action.
Please be seated.
Messages from the President. Announcements by the Speaker.
Honorable members, in the space of 1 week, between the last sitting and this one, I have experienced so many breaches of the standing orders, parliamentary conventions, and customs and practices that these demand that I again highlight them, caution members, and take action to enforce the standing orders. First, publishing and causing in-camera proceedings of the Public Accounts Committee of February 1st. Arriving on my WhatsApp account was a recording of a part of the proceedings of the Public Accounts Committee of Monday, February 1st. It could happen a few ways, among which is that someone who was present at the meeting made the record. I would not speculate on others. I remind honorable members that Standing Order 959A, the meetings of a committee shall be held in private. There are exceptions. Standing Order 959B states, however, sectoral committees and the Public Accounts Committee may sit in public unless the committee determines otherwise. In determining what proceedings shall be held in private, the committee shall strive to reach a decision by consensus, failing which, the provision of Standing Order number 48, decisions of questions shall apply. At the Public Accounts Committee, the custom and convention is that the public is invited when the Auditor General's report is being considered. At the 101st sitting of the 11th Parliament held on December the 3rd, 2018, the Honorable Speaker Scotland said, I noticed that one member had a device which appeared to be recording the statement or recording events in the chairman. I am not sure which one it was. What I'm saying to members is that is not the practice. I caution and implore honorable members to respect and uphold the standing orders and not to bring the proceedings of the Honorable House Committee into disrepute. The second issue I want to deal with is criticisms of the Speaker's decision with respect to claims of bias and impinging the integrity of the Speaker. It seems that after the 16th sitting of the National Assembly, It was open season on the standing orders and the Speaker. At the second sitting of this assembly, I had cause to raise the issue of criticizing the Speaker's decision and accusing the Speaker of bias. One of the best known rules, and I'm quoting from a document that the Honorable Speaker Scotland had used prior, and I used earlier, and I quote again, one of the best known rules of parliamentary procedure, which should be familiar to all parliamentarians worldwide, is that the conduct of the Speaker cannot be criticized except by way of a substantive motion. Close the quote. This was taken from a document, as I said earlier, that the Honorable Speaker Scotland used. Reference in that document was made to the Canadian House of Commons Procedure and Practice, second edition, pages 313, 314, which states, and I quote, reflections of the character or actions of the Speaker, for example, an allegation of bias, could be taken by the House as a breach of privilege and can be punished accordingly. Quote. First, the Honorable Member Sherrod Duncan, after the last sitting, leveled labels at the Speaker which included words such as bias, partisan, and non-partisan Speaker. In one of the Honorable Member's social media posts, backed up with lampoons, he writes, and I quote, Mr. Speaker started out nice, like them new cook shop. And I want to caution members that I'm hearing that when the Speaker is making an announcement, we ought to give the chair the reverence of silence. You don't have to listen, but don't disturb. And then the price raise and the standard fall. I thought after the second bout of COVID, he'd stay closer to God, but the devil's got to him, bias, partisan, you name it. And that is funny. Everyone is showing themselves for 30 pieces of silver. Guess after protesting Granger at Pegasus, there is no coming back. And I close the quote. And he had a lampoon, non-partisan Speaker showing his hands. Honorable members, the Honorable Duncan's social media comments on lampoon is a direct charge of bias against the Speaker, and it imputes on the Speaker's character. It also is something which is not condoned in our Westminster parliamentary system. I urge the Honorable Member to desist. Criticisms of the Speaker, read the narcotics bill, and on the murdered Henrys and Singh motion. On January 28, 2021, the Honorable Member Sherrod Duncan, on another program he hosts, had the Honorable Leader of the Opposition as his guest. They both went on an attack of the standing orders, conventions, and customs and practice, and on the Speaker. The Leader of the Opposition and the Honorable Duncan were criticizing the Speaker's decision on the narcotics bill and on the murdered Henrys and Singh motion. Here is a sample of the commentaries of these two honorable members. With respect to a mistake made by the Speaker saying the ayes have it on the narcotics bill, which the Speaker immediately corrected, the Honorable Member Duncan imputed that the Speaker reversed his decision after he was prevailed upon or coaxed by the government. These were some of his words, and I quote, then his colleagues prevailed upon him, end quote. Open another quote. He had to be coaxed that the opposition cannot win the debate, end quote. Nothing of the sort happened on January the 28th. The Honorable Leader of the Opposition also weighed in, saying the Speaker himself was convinced that at the end of the debate the ayes have it, and that he had to change his initial position. But the most vile and atrocious actions that emanated from the leader of the opposition. These are some of his comments. They, PPPC, are blocking things, and they are getting the help of the Speaker to prevent certain measures from going through. Honorable members, quiet please. The additional majority, and I quote, which they have. I quote again the Honorable Leader of the Opposition. Very early we got an indication that the Speaker was going to take a position on this matter, that the matter was sub judice. End quote. I quote again some of his words. Was not allowed, he was responding to the Honorable Duncan. He said the motion was not disallowed by the government but by the Speaker. Let us put the blame exactly where it is. The last time I criticized him in public, Honorable Chief Whip and Leader of the Opposition, can you control your members, please? Let us put the blame exactly where it is. The last time I criticized him in public, he made a big thing about it. But this time he will have to make a big thing again. Every effort was made to prevent it from being heard, end quote. The Honorable Leader of the Opposition criticized the Speaker's decision to not hear at the 16th sitting the motion on the late Henrys and Singh. He imputed improper motive that the Speaker was in collusion to prevent the motion from being heard. He accepted and he knew what he was doing was against the rules and publicly challenged the Speaker to make a comment on his action. The Honorable Leader of the Opposition knows better. He is a decorated soldier. He is a lawyer. He is intelligent. He is experienced. And he is a most important person in leading our country. I outline here the process of motions and bills. Honorable members, I will have to start calling names and asking people to leave if they continue with these outbursts. Honorable members, all sides. I outlined the process for motions and bills. Standing Order 51-2 deals with private members' bills. Standing Order 51-1 calls for 14 clear days notice, not including the dates of receipt or when it goes in the order paper. Standing Order 24 deals with arrangements of business and how motions qualify for the order paper. Standing Order 24-2 stipulates that every fourth sitting, private members' business gets priority, except if there is a financial paper. Standing Order 41-2 deals with impugning improper motive. The Henry Singh motion was submitted by the Honorable Member Dr. Chandan Edmund on November the 16th. It was read against the standing orders, and the Honorable Member was written to. On November the 23rd, regarding amendments to the motion to make it compliant with standing orders. That is just a few days later. The motion matured 14 days after and was circulated to member via notice paper number 18 dated December 14, 2020. The date for the order paper, December the 11th, I think it was. The date of the order paper that it qualified for was December 14th. The National Assembly met on December 23rd, where the financial paper took precedence. The next sitting was December 28th, and it was agreed by all sides that the matter, that motion, would be deferred to the next sitting. That sitting was January 28, 2021. During this period, developments rendered the motion sub judice. 2 weeks before the sitting, charges were. Honorable members, how could there be collusion to delay or not delay this motion? When within days of receipt, this motion was dealt with. It was circulated on the newspaper 2 weeks after it was received and put as an order paper item on the 14th of December. The issue of matters being sub judice is well documented in our standing orders. The Honorable Leader of the Opposition is known to be a strategist. He achieved a very high rank in the army before he became a lawyer, a politician, honorable members, and Leader of the Opposition. I am sure he studied the seminal works of Julius Caesar in Gaelic wars and Sun Tzu, The Art of War, and he continues to apply them appropriately. I say, I am neither anyone's little boy, nor am I intimidated by front yard or backyard bullies. Any occurrences or reoccurrences of the breaches of the standing orders, I will have to ask a minister to move a motion, and that is in Standing Order 473, to refer the errant member or members to the Committee of Privileges. Thank you. Honorable members, I am asked to inform the members of the Parliamentary Standing Committee for Constitutional Reform that that meeting will be held when we adjourn for lunch right here in the dome of the Convention Center. I also want to add that our standing orders permit any member to sit in on any committee except they can't interject or vote. Thank you very much. Mr. Clerk?
Presentation of petitions.
Mr. Speaker, may I have your indulgence, please?
Honorable Leader of the Opposition, at this time, we will proceed with the order of business, and at the appropriate time, you can make an intervention. I'm going to stick to the rules.
I just wanted to say thank you.
Okay, Honorable Leader of the Opposition, please go ahead.
Mr. Speaker, I want to thank you for your elucidation on the question of the standing orders and the fact that you recognize that I come from a very strong and disciplined pedigree. I think, though, however, please, Mr. Speaker, that we represent on this side of the House over 270.
Thank you, Honorable Member. Thank you very much, Honorable Member. Thank you very much, Honorable Member. We shall proceed.
And therefore, we have a right to speak.
Honorable Member, thank you very much. We shall proceed.
Mr. Speaker, just one point. I just want to say one thing, and that is that, Mr. Speaker, that their reference to my behavior as backyard, I take strong offense to that. That I am not from a backyard and did not have a backyard.
Honorable Member.
Thank you, sir. I take my seat.
Order. Mr.
Clerk, presentation of papers and reports, etc. Reports from committees. Oral questions without notice.
Honorable members, we received 2 days ago a question from the Honorable Member, Dr. Cummings, for the Minister of Health. The question had a number of sub-questions, including the last one, which called for an opinion of the Minister. That is not allowed by the standing orders, and that was deleted. Honorable Member, Dr. Cummings.
Thank you, Mr. Speaker. Mr. Speaker, the first question I have for the Honorable Member Minister of Health, could the honorable member tell this august body where can the comprehensive plan for the management of COVID-19 be found to address the uptick of COVID-19 cases in Guyana? And could the honorable provide a copy of that plan for the COVID-19 in Guyana? It comes against the backdrop that recently the minister received an emergency hospital from the people of Qatar, and equipment was transported and sent to West Demerara to be used and assist in the management of COVID-19 there. But upon arrival there, it realized that they had no staff, and it had to be transported back then, go to Liliendal. The second reason for the question is that borders are very porous, our porous borders with a new strain of coronavirus emanating from Brazil, our neighbor. There is a possibility of reducing the efficacy of any antibody treatment for patients with the coronavirus. What plan does the minister have to address this public health concern? So basically, what's the comprehensive plan? May I have a copy if it's available?
Thank you very much.
Honorable Minister of Health.
Thank you very much, Mr. Speaker. Thank you very much, Honorable Member, Dr. Cummins. The member, Mr. Speaker, asked, where is the comprehensive plan? And the comprehensive plan is with the stakeholders who are implementing the plan. And as you know, the plan has various sections, including the provision of personal protection equipment for the frontline health workers. And we have been sourcing these types of things like masks, goggles, face shields, gongs, the hair cover, foot cover, and all that is necessary for these frontline health workers to protect themselves while delivering care. And that situation has increased dramatically from what we have inherited. The second component of the plan, Mr. Speaker, talks about increase in testing. And with increased testing, as you would know, when we came into office, we were only doing about 21 tests per day. And while we were doing 21 tests per day, our range of tests were very limited. And so as of now, at the National Public Health Reference Lab, we are able to do about 1,500 to 2,000 PCR tests per day. That has increased our capacity tremendously. And on an average day, we are doing close to 450 tests, PCR tests. In addition to that, Mr. Speaker, the private sector has come on board, and Eureka Medical Laboratories have also been doing PCR testing. And there are a number of other institutions that are pending accreditation from the Ministry of Health. Apart from PCR testing, we are also using the GeneXpert machine to provide point-of-care testing in several regions. As of yesterday, we have now placed the GeneXpert machine in Letem so that we can do point-of-care testing there. And one such machine is also in Region 1, and during this week, we'll send a team out to train those persons in Region 1 so that we can start utilizing that GeneXpert machine there. There's also an additional GeneXpert machine that is in Region 6 and one that is in Region 10, and we are procuring about 2 others that we'll place in some of the other regions. In addition to PCR testing, which is both the GeneXpert and those that we do at the National Public Health Reference Lab, we are also doing antigen testing. And apart from the National Public Health Reference Lab being able to do those tests, we have now been able to accredit a number of institutions, including all the regional hospitals and a number of point-of-care areas health centers, and so forth, where antigen tests can be done in the public sector. In addition to that, we have already accredited 5 private sector entities to be able to provide antigen testing, and we are in the process of accrediting another 5 this week. By this weekend, those names of those other entities would be published. In addition to improving testing, Mr. Speaker, another component of the plan talks about contact tracing. And with contact tracing, we have our central team at the surveillance department who is responsible for contact tracing. And in every region of Guyana, the regional task force comprising of the RHO and his team are required to do contact tracing. So we have a comprehensive network of persons who are doing contact tracing. And I must say to the honorable member that every morning at 7:30 in the morning, each RHO reports on the things that happen within their region pertaining to COVID, how many new cases they have, what steps they are going to take in terms of the cases that they have, and the plans that they have to do contact tracing or additional testing. And this is happening every single morning, whether it's a holiday, whether it's on the weekend, whether it's Sunday, the RHOs and that team is reporting every single day. In addition to this, Mr. Speaker, another component of the plan speaks to isolation and quarantine facility. And every region has at its disposal public buildings that have been repurposed and retrofitted as isolation centers, and the same for quarantine facilities. So we have adequate space in our institutional quarantine areas and, of course, the isolation areas. Additionally, another component of the plan deals with clinical management of patients. And here we have sought to increase the bed space and bed capacity for persons with COVID. And so at every regional hospital now, the doctors have been trained to be able to manage COVID cases. And so if you have mild symptoms and you're in the isolation facility, you would be managed by one of our doctors who have been trained to do so. And if you have more severe symptoms that require hospitalization at any one of our facilities at the regional level, you would be able to get that type of care. In addition, we have the Ocean View facility where we have 150 beds that are right now being utilized. And of those beds, we have 25 ICU beds. So persons needing ICU care can get that care at the Ocean View facilities. And with complicated cases, if the regions cannot manage them, we send them down to this specialized facility where we can offer care for the more complicated patients. In addition, Mr. Speaker, you would realize from the press that the government of Qatar has kindly donated to Guyana a field hospital. And that field hospital has 60 beds, of which 20 can be used as ICU beds. We are currently in the process of determining which one of the areas we are going to set up that facility. Initially, as the honorable member said, we wanted to set that up in Region 3, and we have made such an analysis of what we can do there, and then we thought that maybe we can consolidate it at Ocean View. So there are still some decisions to be made, but at this point in time, we have enough bed capacity for both persons who require normal hospitalization or ICU hospitalization. We have enough capacity currently. And very shortly, we will determine exactly where we are placing that field hospital. And once we do that, we will set up that hospital. In addition to these aspects relating to health, Mr. Speaker, we have also developed a number of workplace strategies, and that is another component of our plan as we work with different workplaces in ensuring that they have the measures relating to COVID so that they can continue working in those facilities. And of course, another component of the plan deals with our economic relief, and the government of Guyana has been working with small businesses to provide COVID economic relief to businesses who have been affected by the disease. And we have also, as you would know, rolled out a plan where each household benefited from $25,000 as COVID relief. And we have some measures when we lock down specific areas. We were able to provide hampers through the CDC and other organizations. So economic relief has also been part of our plan. And of course, Mr. Speaker, another component of this plan deals with public education. And while we have an aggressive program on television and social media, we have also been working very closely with the joint services through Operation COVID Curb to ensure that our citizenry are well aware of the dangers of COVID and the measures that they can take to protect themselves. And then the most recent component, Mr. Speaker, that we have added to our plan is to ensure that we acquire vaccines to prevent the disease. And we have worked out a system of how we are going to allocate these vaccines and roll out this program. So, to the honorable member, yes, we have this very comprehensive plan, and I just give you a broad approach to what we are doing. And also, yes, we can make a copy of this plan available to you. Right now, we are updating the most recent component dealing with vaccination, and as soon as we finish that component, we can make that plan available to you. Thank you very much, Mr. Speaker.
Thank you, Honorable Minister. Honorable members, I just want to bring your attention to the standing orders, which says that 20 minutes are allocated to this particular session. Honorable Member, Dr. Cummins.
Thank you very much, Mr. Speaker. Thank you, Honorable Minister, for the plan. I'm assuming that you'll, before the day is out, you'll give me that plan. The second question, could the Minister tell this August Assembly if the Ministry of Public Health will be able to adequately monitor the impact of these variants as the coronavirus variant strain I'm talking about, as the coronavirus continues to mutate while the COVID-19 spreads and the citizens of Guyana await testing for the variants? Right.
Honorable Minister.
Thank you again, Mr. Speaker. Mr. Speaker, I have a little challenge here. Because, as you would know, with the new government, the entity known as the Ministry of Public Health ceased to exist. So if we are talking about that entity, then I would say that I am not sure whether they had the capacity to be able to do gene sequencing, and more so because after our first case in March, on the 11th of March, one of the variants that were circulating then, which became a dominant variant around the globe, was the D614G. And I haven't seen any reports by any person in the ministry that points to them understanding that this was a mutant variant that was circulating. So I would say at that point in time with the Ministry of Public Health that they did not have the capacity to do so.
Thank you, Honorable Minister. Honorable Member, Dr.
Yes,
Karen
thank
Cummins.
you, Mr. Speaker. The public health mantra, be it public health or health, whatever you say, the fact remains, public health mantra is healthy people and healthy communities. I think both we are assuming the same problem. And by the way, the P1 strain from Brazil our border is very close, so you can take note of that. The next question, Mr. Speaker, in the light of this new variant strain of the COVID-19 virus, does the minister plan to scale up the purchase of vaccines? You speak about that you have the plan, but then I saw the former CARICOM chairman saying that 100,000 vaccines they were expecting, and it seems as though it may come in drips and drops because of the richer countries getting. So I want to know if you plan to scale up and if you're sure about those vaccines that you expected to have.
Honorable Minister of Health.
Thank you again, Mr. Speaker. I'm not sure what's the nexus between the variant strains and the vaccines, but nevertheless, I would endeavor to answer the honorable member, and that is, indeed, we have been looking at the various strains that they have. The one that is next door, the P1, we have been looking at that particular strain and what is happening in Manaus and the state of Roraima. And that is one of the reasons why we have closed the border between Guyana and Brazil, and we have also stopped all flights from Guyana to Brazil and vice versa. So we are monitoring the different strains. Right now in the world, Mr. Speaker, the B117 strain that was first found in the UK, it is now in 80 different countries. And the other strain, which is the B1135, the South African strain, as it's commonly known, or was first determined in South Africa, that is right now in 40 different countries. And the P1, which was originally discovered in Japan from travelers emanating from Brazil, that one is right now in 10 different countries. So we are monitoring the different strains and what is happening. We participate on a weekly basis with the WHO as they tell us more about the strains and what is happening with them. We are part of a network of 22 laboratories in South America and in the Caribbean that has been monitoring and doing gene sequencing so that we can know about the circulation of the different strains. So this is happening. And as you would know, Mr. Speaker, we have a partnership now with CARPA where we are sending every month at least 10 samples to CARPA so that they can do gene sequencing. We have sent the first 10 samples and we are awaiting the results. And right now we are working on a partnership with PAHO to be able to send through PAHO to the CDC in the United States so that we can add to the range of sequencing that we can do. And so these are how we are tracking the different variants. In addition to that, Mr. Speaker, the honorable member asked about vaccines. And yes, we have been working through the COVAX facility, COVAX AMC, to be able to get vaccines for Guyana. And COVAX has allotted to Guyana for 20% of our population. The first installment of those vaccines, we are expecting that we are going to get 104,000 doses. And so we would have adequate vaccines to be able to immunize our frontline workers. Those vaccines, they are going to be the AstraZeneca vaccine, and that is being manufactured by the Serum Institute of India. But what is pending is the WHO authorization, because it's not listed by WHO as yet, and the WHO expects that by the mid of this month, that they will be able to grant emergency use authorization for the AstraZeneca vaccine. This vaccine is already in use in the UK, where it has been granted emergency use authorization. It has been in use in the EU, where again they have granted it emergency use authorization, and it has been granted emergency use authorization in India, the place where it's being manufactured. So we are going to get those vaccines. And in addition to that, the government of China has donated to us 20,000 doses of vaccines from Sinopharm. And Sinopharm is one of the biggest manufacturers of vaccine globally. And so we are going to get those vaccines shortly. In addition to the COVAX arrangement that I spoke about earlier, we are in a number of bilateral talks with various countries, including not only China, but Russia, India, to ensure that we can have more than that 20% for this year. And we are also talking to a number of multilateral agencies through which we think we would be able to acquire vaccine. One such multilateral agency is CARICOM has brokered an arrangement with the African Union, and they have set aside 1.5 million doses of vaccines for the Caribbean. And out of that allotment, Guyana's quota is going to be 149,000 doses. And so we are working with that platform to ensure that we will also get doses from that mechanism. In addition to that, we have been engaging the manufacturers themselves, including those who are manufacturing the mRNA vaccines and some of the other types of vaccines that we think in the short term would get emergency use listing.
Thank you, Honorable Minister. Honorable members,
My penultimate question.
honorable members, we would have exhausted the 20 minutes, but this is, I consider, very, very important. So I allow Dr. Cummings, the honorable member, to continue to the auditor.
Thank you, Mr. Chair, for your consideration. The penultimate question. Would we see in Guyana, Honorable Minister, another lockdown to help contain the virus and perhaps school closure anytime, bearing in mind that several countries are beginning to impose travel bans as a consequence? There are lockdown in countries like our sister country like CARICOM, like Barbados, South American country like Peru, Israel. There are travel bans in Europe and USA. I just want to know what's your plan. I haven't seen it, so would you consider lockdown going forward or no?
Honorable member, Minister of Health.
Thank you again, Mr. Speaker, and thank you, Honorable Member, for that question. Pertaining to lockdown, that's always an option. But as you know, that in our management of COVID here in Guyana, we have exercised that right to do partial lockdowns, and we have done that in many communities. So that's an option. In addition to that, we have also, as you rightly said, some countries have restricted flights, and we have used that tool as well, because our flights going out to Brazil or flights emanating from Brazil, we have now stopped all of those flights. So these are tools that countries would use, and we would, as we deem it fit and based on the epidemiological situation that we are monitoring, we would also employ those tools as we see fit.
Thank you, Honorable Member. Dr. Cummings.
The last question, yes. Thank you, Mr. Chair. You've alluded to this question before, but just to reiterate, is there adequate public health infrastructure to keep pace, with this effective testing, treating, the three T's, testing, tracing, treating, and the isolation, because it's increasing. We're about 7,000 now, our case fatality over 15%, and we have infrastructure to keep, if it increases the uptick, do we have adequate infrastructure?
Thank you, Honorable Minister of Health.
Thank you again, Mr. Speaker. Thank you, Honorable Member. Indeed, at this point in time, we do have adequate capacity for testing, contact tracing, treatment. We have all these things in place. I outlined earlier some of the steps that we have taken, and you can rest assured that in every region that we have put testing in place. We have expanded the hospital capabilities, and of course, we have contact tracing in those regions. So we have the capability right now, and we are expanding those as well. So you would have seen recently we have made some move in terms of expanding the infrastructure that we have, just in case. And we hope we don't have to use it, because we are moving to the next phase now, where we strongly believe by the utilization of vaccines that with the right amount of persons taking these vaccines, and once we get high uptake, that we will be able to develop herd immunity in Guyana, which would allow us to exit the pandemic here.
Thank you, honorable member. Honorable members, we had received indications from a number of persons, members, who said that they were going to be on virtually. I just want to place on record those who are on at this moment at 11:41. The honorable member, Ms. Philadelphia. The honorable member, Mr. Rajkumar. The honorable member, Mr. Raphael Chotman. The honorable member, Ms. Catherine Hughes. The honorable member, Dr. Vinya Prasad. The honorable member, Dr. Utah. Sorry, Mr. Utah. Those members are on right now. Honorable members, Mr. Clerk.
Questions and notice.
Honorable members, we have for written replies 2 questions on today's order paper. These questions, number 1 and 2, are in the name of the honorable member, Ms. Tabitha Sarabo Hali, and they are for the Honorable Minister of Public Service. These answers have been received and have been circulated in accordance with the standing orders. Mr. Clerk.
Statements by ministers, including policy statements, personal explanations, request for leave to move the adjournment of the National Assembly on definite matters of urgent public importance, motions relating to the business or sittings of the National Assembly and moved by a minister, introduction of bills, public business, government's business.
We now move to the second reading of the Fiscal Management and Accountability Amendment Bill 2021, Bill number 1 of 2021, published on the 27th of January 2021. Honorable members, we will now proceed with its second reading. Honorable Senior Minister in the Office of the President with responsibility for finance.
Thank you very much, Mr. Speaker. I rise today to move that the Fiscal Management and Accountability Amendment Bill 2021, Bill number 1, 2021, published on the 27th January 2021, be now read a second time. Mr. Speaker, this bill, the Fiscal Management and Accountability Amendment Bill, is in fact, at one level, an extremely simple bill. It seeks to enact a few amendments to the Principal Act, the FMAA as it is now popularly known. And these amendments are designed to streamline the budget process, and to increase its efficiency, and to improve the effectiveness with which Parliament can consider the budgets of these entities. And so, Mr. Speaker, it is indeed my expectation that this amendment bill will enjoy swift and smooth passage through the House and unanimous support on both sides of the House. Mr. Speaker, it will be recalled that the FMAA, when it was first introduced in the National Assembly in 2003, represented a vast and comprehensive piece of legislation intended to overhaul the fiscal management architecture of the country. repealing and replacing as it did at that time the Financial Administration and Audit Act that we had inherited from colonial times, and which, though it had served an extremely useful purpose over the years, had outlived by then its usefulness and its relevance to modern financial management practices worldwide. And so the FMA was introduced, like I said, comprising a comprehensive architecture, legislative architecture, to govern the entire budget process, from budget preparation to budget execution to ex post reporting and accountability arrangements. And that new act, brought into law in 2003, served our country well for many years, and has often been cited by members on both sides of this House, sitting in our respective places, indeed on both sides, in successive parliaments, demonstrating its utility and its value and its sustained relevance as it relates to the management and accountability of public money. The particular amendments that we are moving today relate to certain provisions that were inserted into the Principal Act in 2015, shortly after the change in administration. In 2015, I believe it may have been in June or July of 2015, shortly after our colleagues on the opposite side of the House would then have assumed government, the then government brought to the National Assembly an amendment bill to amend the original FMA. And that amendment bill related to the budget process that was to govern constitutional agencies, as they were then described, and in particular, constitutional agencies. The term constitutional agencies was interpreted to mean, although not defined in the FMA amendment at the time, the term constitutional agencies was interpreted to mean those agencies listed, those entities listed in the third schedule to the Constitution. There was, in fact, a companion bill, a Constitution amendment bill, that sought indeed to expand the list of those agencies reflected in the third schedule. The intent stated at the time, the intent of the FMA amendment bill, was, the stated intent was to give effect to Article 222A of the Constitution, which relates to the financial autonomy of the said constitutional entity. And the then amendment articulated a two-stage process whereby the budgets of constitutional agencies would be brought to the National Assembly, considered by the Assembly and approved, and then incorporated into the national budget, which would subsequently be submitted to the House for consideration, at which time the budgets of the constitutional agencies which had been so incorporated would not be reconsidered by the House, but would simply form part of the annual budget. It might be worthwhile to note, Mr. Speaker, that the 2015 amendment represented, in fact, the second time that the APNU AFC had sought to introduce this amendment, the previous occasion being one that preceded their assumption of government, during, I believe, that would have been the 10th Parliament. On that occasion, the FMA amendment bill did not receive the benefit of presidential assent, and for very good reason, and reasons which, Mr. Speaker, I will shortly elaborate on. Mr. Speaker, while the intent to give effect to Article 222A is perhaps one worthy of commendation, the process that was articulated in the FMA Amendment Bill, instead of giving effect to the said article, had in fact the result of colliding with certain critical aspects of that article, and colliding in a manner that rendered, in fact, the process of this Assembly's consideration of the national budget convoluted, complicated, and in fact problematic. And I will cite at least one significant example in this regard. And so, Mr. Speaker, while the amendment that we are now bringing to the House seeks very simply to remove this two-step process that involves the prior submission of the budgets of the constitutional agency, to remove this two-step process, or to combine these two processes into a single submission of the National Assembly for reasons that I will elaborate shortly. And so, on that basis, constitutes a very simple amendment and very intuitive amendment. The bill, in fact, addresses issues that are very fundamental as well. And I wish, Mr. Speaker, to highlight a couple of these very fundamental issues that the bill seeks to address. First of all, Mr. Speaker, it is a well-established principle, both in our Constitution and indeed in the traditions of our Parliament and in parliaments like ours, that certain responsibilities as they relate to fiscal matters are vested in the executive. And this perhaps is best exemplified, Mr. Speaker, by Article 171 of the Constitution, which clearly articulates that certain matters relating to the public finances, including the levying of any taxes, or the incurrence of any expenditure, or the causing of any charge against the consolidated fund, that those matters can only be brought before this House with the prior consent of Cabinet signified by a minister. Indeed, Mr. Speaker, this article of the Constitution refers not only to bills, but even to motions. And it specifically says that the Parliament, the National Assembly, shall not proceed on any bill or motion for imposing or increasing any tax, for imposing any charge upon the consolidated fund or any other public fund of Guyana, or for altering any such charge, for the payment, issue, or withdrawal from the consolidated fund or any other public fund of Guyana, of any monies not charged thereon, or any increase in the payment of any increase in the amount of any such payment, etc., for compounding and remitting any debt, etc. That such matters, whether bill or motion, shall not be proceeded upon by this Assembly except on the recommendation and with the consent of the Cabinet. This particular article, Mr. Speaker, is in fact replicated in the standing orders of our own August Assembly, reinforcing the role of the executive in matters relating to public finances, and with good reason. Because as long as we will hold the executive accountable for fiscal outcomes, then the executive must, of necessity, have an appropriate role to play as it relates to fiscal matters. Later today, Mr. Speaker, we will be debating two orders relating, or two motions seeking to confirm orders relating to the public debt of Guyana, domestic and external. Compliance with the ceilings prescribed by those two orders is the responsibility of the incumbent government. And to the extent that the incumbent government is responsible for managing the fiscal affairs of the country, to ensure compliance with those ceilings, the ceilings prescribed therein, it behoves the incumbent government to manage all of the operations that affect the public finances to ensure compliance with those laws. And so, Mr. Speaker, the principle regarding the involvement of the executive as it relates to matters in finance is in fact very well established, like I said, in parliaments similar to ours across the world. What the 2015 amendment sought to do, and in fact did once enacted, was to curtail and diminish the executive's role. And in fact, those budgets no longer came to the National Assembly submitted by the Minister of Finance, or the Minister responsible for Finance, or with the prior signification of consent of Cabinet as is required by our Constitution, but instead were submitted through the offices of the Clerk of the National Assembly. And of course, with no respect whatsoever intended to the distinguished Clerk of the National Assembly, the function of managing the public finances, the function of ensuring compliance with any ceilings, whether on debt or any other fiscal ceiling, the function of ensuring the achievement of fiscal outcomes rests with the minister responsible for finance and the government of which he's a part, he or she is a part. And so, Mr. Speaker, that 2015 amendment violated that cardinal principle that required the executive's involvement in the management of the public finances. The underlying principle, Mr. Speaker, is that if we will hold the executive accountable for the achievement of fiscal outcomes, then the executive must be clothed with suitable authority to ensure the achievement of those outcomes. Otherwise, Mr. Speaker, if we want to carve out a part of the budget and remove the executive from involvement and consideration of that part of the budget, then we need to exclude that part of the budget from any ceiling that would be applicable to the fiscal outcomes for which the executive is responsible. But that, of course, was not done. But secondly, Mr. Speaker, and equally fundamentally, the language of Article 222A was very clear, sufficiently clear that I believe it would be obvious to all of us what the intent of the framers of this article was. Article 222A says, in order to assure the independence of the entities listed in the third schedule, the expenditure of each of the entities shall be financed as a direct charge on the consolidated fund, determined as a lump sum by way of an annual subvention approved by the National Assembly, after a review and approval of the entity's annual budget as a part of the process of determination of the national budget, of the determination of the national budget. And I want, Mr. Speaker, to repeat that particular part of the article for emphasis. after a review and approval of the entity's annual budget as a part of the process of the determination of the national budget. And we might, Mr. Speaker, ask ourselves, why did the framers of Article 222A, which was inserted in our Constitution in our 2001 constitutional amendments, following the comprehensive constitutional reform process that we all took part in, why did the framers of that particular article go to the lengths and take the pains to specify that language that required the approval of the budgets of the constitutional agencies to be a part of the process of the determination of the national budget? The insertion of that language, Mr. Speaker, was not an accident. It was in fact very deliberate, and very deliberate for the following reasons. A cardinal principle of sound fiscal management is unity and comprehensiveness. When one is examining the national budget and considering how various allocations will impact on the macroeconomy, on fiscal outcomes, it is unavoidably necessary that one should consider the budget in its entirety. The budget, after all, Mr. Speaker, is a process of prioritization. It's a process by which means a range of competing calls on the public treasury, typically all very, or more often than not, all very legitimate calls on the public treasury, but a wide range of competing calls on the public treasury are considered amongst each other. And a process of prioritization is undertaken in order to achieve an outcome that optimally allocates the finite fiscal resources that are available to the country across these competing needs. And unavoidably, Mr. Speaker, some agencies will not get what they request. Many agencies have vast and ambitious and very legitimate plans for rolling out their agendas for developing their respective sectors. And here indeed, Mr. Speaker, I speak equally to many of my colleagues on this side of the House, many of whom, were there not to be a fiscal constraint, would have very ambitious plans to transform their respective sectors. But, Mr. Speaker, we as a government, and indeed this Assembly, in considering the national budget, must have a view of the entirety of the national budget, must have a view, a comprehensive view. Otherwise, Mr. Speaker, this Assembly is being asked to consider and approve a part of the budget in isolation from all of the other competing calls on the public treasury. And this is an important issue. And it is an issue that has arisen in this very House over the course of the last 5 years. And I will cite just one of many examples. Imagine, Mr. Speaker, that we are coming to this House and asking this House to approve the budgets of a long list of entities carved out of the national budget, extracted from the totality of all budgetary calls in this country, presenting this carved out part of the budget and saying to the House that in isolation of what else is happening in the economy, we are asking you to approve these budgets. Irrespective of what is expected to happen with growth in the economy, irrespective of what is happening with respect to revenue in the economy, irrespective of what is happening with respect to other calls on the budget, we ask the National Assembly, we carve out this subset of the budget and we say, we are presenting this to the National Assembly and we're asking that you blindly, because you don't have a view of the rest of the public finances, that you blindedly or blindfoldedly approve this part of the budget, irrespective of how it fits within the broader fiscal framework. Indeed, Mr. Speaker, it will be recalled that the 2015 amendment required the Minister of Finance to submit his comments. And, Mr. Speaker, I will give just one example of what was submitted by my predecessor in office by way of comments to support the recommendation that he was making. And I quote, and this is the document that was circulated to this House requesting approval of the recommendations of the executive. And it was the recommendations of the executive that was brought for approval and ultimately that were approved. This, Mr. Speaker, is the comment of the Ministry of Finance, my predecessor, that was put before this House. Recommended allocation is made in the context of existing fiscal space and the consideration of the agency's request within national development priorities. End of quote. And this assembly was asked to approve these budgets without a picture of what this fiscal framework was all about, without a picture of what revenue development would look like, without a picture of what the anticipated growth in the economy would be. And so indeed, Mr. Speaker, it would be fair to say that this House was really being asked to approve these budgets blindly. This fact, Mr. Speaker, I'm happy to say was not lost on my colleagues on this side of the House, who at that time were sitting on the opposite side of the House. And I quote, Mr. Speaker, from the debate on the 2018 budget, but you see this trend every year. I quote from the 2018, the debate on the 2018 budget, from my distinguished colleague, the Honorable Minister Teixeira, then the Honorable Member Gail Teixeira, who said as follows. The Honorable Member said at the time, when the Fiscal Management and Accountability Act was amended in 2005 and we started this process of having the constitutional bodies dealt with separately, we did this before the Minister's budget presentation. That's very important. So the full set of fiscal projections had not come to the House. The revenue projections had not come to the House, and the Honourable Member correctly identified this and said as follows. And that we do not know what the projections